Namaste. Welcome to the Mindful Eating series. In the previous video, we have seen why it is very important to focus on our eating habits and which type of food we are eating and its importance and its influence on our health, on our holistic health. In fact, in today's video, we'll see what is mindful eating and what are different diseases, diabetes, hypertension, and what are the limits there, and what is BMI, and what is malnutrition. And we have found in the previous video that the root cause for all these diseases is our food habits. So how to control them mindfully, and what is the importance of this mindfulness in eating, that we will see in today's session. Let us start with understanding diabetes. What is diabetes? It is lack of insulin or insufficient insulin in the body. Lack of insulin is type 1 diabetes and it is hereditary in nature. It runs in families, and type 2 diabetes is controllable and it produces insufficient amount of insulin, and it can be cured by changing our food habits and lifestyle modifications and with some medication also. The normal values, we have already seen that test is very much important to identify whether we have diabetes or not. We should identify the blood glucose levels. The normal values uh, for the blood glucose levels of a normal person are: fasting plasma glucose level should be less than 110 milligrams per dl, and HbA1c should be less than 6%. What is this? We will see. And it is the 3 months average of sugar levels in your hemoglobin. That should be less than 6%. It is measured in percentage. And 2 hours plasma glucose level. Plasma is blood. Blood glucose level should be less than 140 milligram per dl. After ingestion of 75 grams of oral glucose, with a oral glucose load of 75 grams, after 2 hours, if we measure the plasma glucose level, it should be less than 140. That is the normal value. When we will say it is diabetes, when the patient is diabetic, then his or her fasting plasma glucose level will be more than 126 milligram per dl. It is as per WHO. HbA1c will be greater than 6.5 for a diabetic patient, and 2 hours plasma glucose is greater than 200 mg per dl. Suppose if the values are between these and normal values, then we can say it is pre-diabetic stage, and some lifestyle modifications will help us. So we should always monitor these values regularly, then we can understand what is the status of our blood glucose levels, based on which we can assess whether we are diabetic or not, or pre-diabetic, or any precautions or medications or dietary changes can be done to control the diabetes. HbA1c is glycated hemoglobin. It is measured for 3 months, and 3 months average will be measured with a blood sample, and we can monitor this diabetes by using personal monitoring technique, that is through glycometer. We have glycometers nowadays in every home. We can take a blood drop and keep it on that, then it will show the reading in milligrams per dl. We can cure diabetes with proper medication. Even if the insulin is insufficient, insulin is injected also in some patients, and we should take the medical practitioner's advice in dealing with diabetes, endocrinologist basically. Now we'll see what is hypertension. Hypertension is measured in two values, that is the blood pressure. One is systolic pressure and divided by the diastolic pressure, that is 120 by 80. We are normally know that the normal value for hypertension is 120 by 80. We should maintain. What is 120? That is systolic pressure. Systolic pressure is the maximum pressure during one heartbeat. Heart is like a pump and blood is the liquid which is pumping uh, to all the organs of the body. Diastolic pressure, that is the minimum pressure between two heartbeats in a cardiac cycle. So that should be 80, and systolic pressure should be 120. So 120 by 80, it is measured in mm of Hg. It should be the normal value. Clinical mercury manometer is the instrument used for measuring uh, hypertension in the hospital scenarios. Sphygmomanometer, that is aneroid, is used in hospital settings. Electronic, nowadays we have electronic gadgets useful in measuring hypertension. We can get the values in mm of Hg, and mercury manometer we have already seen in even that pumping set is there with the mercury level indicating, and with the stethoscope they will be monitoring. That is normally done by the medical professionals and the nurses and hospital uh, staff in the hospital settings. So what we can do is we can buy an electronic instrument which will show the digital values, and we can measure with the cuff uh, tied to our hand. At home we can also monitor, that is self monitoring. What is BMI? We have already seen in the previous video also that it is the ratio of weight to square of your height in meters. BMI should be greater than 25 if it is declared as overweight. If a person is overweight, then his BMI will be more than 25. If the person's BMI is more than 30, we will declare him as obese. So the limit is BMI should be always less than 25. Then it is normal. If it is more than 25, we will declare them as overweight, and if it is more than 30, it is obese. The fundamental cause of obesity and overweight is an energy imbalance between calories consumed and calories expended. So the calories intake should be proportional to the energy we are expending. We are spending so much of energy in different activities. If the energy spent on activities is more, then our calories intake should be more. It should match with the energy spent on different activities. So if you are not spending your energy on the physical activities, then the calories intake should be less. That is how we should balance. And it holds good for maintaining your diabetes and hypertension levels, also sugar levels and blood pressure levels. An increased intake of energy dense foods that are high in fat and sugars is the cause of obesity and overweight. An increase in physical activity due to the increasingly sedentary nature of many forms of work like software people and other forms of uh, latest world works and jobs, in which most of the physical activity is not there, only the mental activities are there. So intellectual jobs are there basically. So the changing modes of transportation and increasing urbanization are some of the other root causes uh, which are increasing the BMI of different people throughout the world. And this is also as per our WHO, World Health Organization's report says that an increase in physical activity due to increasingly sedentary nature of many forms of work is the leading cause of increasing BMI of several people in the world. And changing modes of transportation, earlier people used to walk. Nowadays the transportation and the automobile sector has, and the technology has improved in such a fashion that the transportation modes have got changed, and we are not going by walk. So the calories consumed is becoming less. So we are consuming less calories. That is, we are not involved in the physical activity, and increasing the urbanization. All these are other factors to increase the BMI. Here, the important aspect is the food habits. On one side, it is increasing the obesity. On the other side, malnutrition is also there, prevailing in the low income and middle income countries. Both obesity and malnutrition, both are two sides of the coin for the middle and lower income group countries. So it is adding double burden to such countries. Malnutrition on one hand and obesity on the other hand. So these countries have to deal with both type of problems which are quite contradictory to each other. And it is just because of the food problems. As per WHO, the healthy diet, that is the balanced diet, means what? Fruits, vegetables, legumes, that is lentils and beans, nuts and whole grains. Mostly those should be unprocessed, maize, millets, oats, wheat and brown rice. All these are considered to be healthy food as per WHO. Even website, Indian health website also uh, confirms this. So I'll give both the links in the comments section. You please go through those documents. They have clearly explained how much percentage of food in proteins we should take, and carbohydrates how much percentage, oils how much percentage. Everything is crystal clear there in those documents. Please, every one of us should go through these documents to become aware of what is balanced diet and how to eat a healthy food. 400 grams of fruit and vegetables per day is recommended as per WHO. Free sugar should be less than 50 grams per day per person, and salt should be less than 5 grams per person, that is almost equivalent to a teaspoon. A teaspoonful of salt only should be consumed by a person in a particular day. So it is like 4 people are there means 20 grams, and 1 kg salt if you are taking, it should almost come to how many days? More than 2 months, let us say. So That is how you can proportionately calculate how much salt we are consuming and how much. And one more important thing is some of the natural substances like uh, the green vegetables, those have the inherent salt. The sodium is already there in some of the leafy vegetables. So that we are not including that. It is not measurable, right? So we should consume much more less than 5 grams because natural intake of sodium is there from the food, from fruits, in the form of fruits and vegetables. So that we are not counting. So ideally the salt intake in the salt form should be much below 5 grams, and less than 30% of fats only should be consumed. That is, of the total diet, only 30% should be the fats. In that also, most of the portion should be with unsaturated fats. These unsaturated fats are there in fish, avocado, and nuts, and in sunflower, soybean, canola, and olive oils, more than saturated and trans fats. So unsaturated fats should be consumed more than saturated and trans fats. These trans fats and saturated fats will be there in the junk food and other oils, milk, and other animal related uh, meat. All these things will have saturated and trans fats. So we should try to avoid those things, and those should be below 1%. Eating habits are dictated by some key factors. What are those key factors which are affecting our eating habits? Let us try to understand what dictates our eating habits. Age is a factor which determines our eating habits, eating patterns, eating styles, and the items which we consume. All those things are dependent on our age. In the early age, in the childhood, our eating habits are different from the middle-aged person and the old age people. So even a kid, for him the breastfeeding milk is very important. For an adult, the intake of minerals, proteins, protein rich food, fiber rich food is very important for an adult. So for the people above 60, there is a separate diet suggested by WHO, and even in our Indian government website also it is available. The culture and tradition has an impact on our eating habits. Suppose, let us say, for a particular festival, uh, we should eat a particular type of sweet that comes in tradition or culture. So our habits of taking sugar or sweet on that particular occasion are in tradition. They are coming in the culture and from the culture and tradition. So we cannot deny that. So our eating habits will have uh, some predecessor, that is our culture and tradition will dictate our eating habits. And demography, of course, in South India they eat rice, and in North India we eat wheat. So the demographical changes or the weather conditions also will have an impact on the eating habits. So in summer we eat certain kind of food, and winter we eat certain kind of food, and the fruits and vegetables are also seasonal in nature. So our food habits, our food will consist of some of the seasonal food items also. So our eating pattern will change, our habit will change. Health. uh, a healthy person will have some eating habit compared to uh, unhealthy person. So obviously health is one of the key factors which will determine our eating habits. Behavior, our emotions. We have already seen sattvic diet, sattvic thoughts, and tamasic thoughts and tamasic diet. That loop also we have discussed in the previous video. So our emotions, our behavior, and how much we have a control on our emotions, our temptations, that will again determine our eating habit and eating pattern. The economic status, how much we are economically sound to buy almonds or to buy um, cashew nuts, etc. So that will determine our habit of eating those items. Suppose if we are poor, we will be settling with some other food items. So the economic status of a particular person will also determine the eating habit. The profession and type of job. This has already been quoted by WHO also. The sedentary nature of the present job conditions is one of the root causes for this high BMI, and that is influencing the other factors. So the eating habit uh, is dependent on the profession and the type of job which we are performing. Influence of others, peer pressure or parents pressure. So all these also influence our eating patterns. Then what is mindful eating? So much of factors are influencing our eating. So, but we should concentrate on our eating pattern, our health, just forgetting all these other factors, just ignoring them. So that is mindfulness. What is mindfulness? Being aware of our thoughts. So many factors are already there influencing our eating pattern that we have already understood. Just we are aware of that. Observing those thoughts. Here also we are observing those factors. Achieving concentration and focus. This is mindfulness in general. Okay, several thoughts are coming and going, but we are focusing on a particular thing. That is mastering the mind. So here also so many factors are influencing our eating habits, but still we are focusing on a particular healthy diet. Okay, our temptations are there to eat more salt, but as per WHO recommendation, it should be less than 5 grams. So we are very much determined to focus on our food intake, and we are focusing on that to restrict the salt intake below 5 grams. So that is how our concentration and focus is on our food intake. So we are controlling the emotions, we are controlling the temptations by focusing on this. That is mastering the mind. With a holistic view that these factors are also influencing, that you are observing, but you are not denying those factors. You are just becoming a careful observer of all these factors and trying to focus on your food intake. That is how mindful eating comes into picture. That is how we can define mindful eating. What is mindful eating means? Focusing on your eating. That's all. With a holistic view of macro to micro. So I have explained all the bigger factors influencing our food. Finally, we should concentrate on the food which we are taking. So that is micro. From macro, bigger perspective to a concentrated perspective, we should be in a position to change. We should be in a position to visualize from a macro to micro perspective. That is, our mind should be like the lens of a camera, which can be zoomed to see the bird's eye clearly and unzoomed to see the bird's eye view. So we should be in a position to see the bigger picture also, and simultaneously a pinpointed version of bird's eye. So we should be in a position to concentrate and open up also. Both the things should be there, like the lens of a camera, which can be zoomed to see the bird's eye clearly and unzoomed to see the bird's eye view, means bigger picture. Turn inward and outward. So we should understand our body, what it exactly requires, and outward, externally, what is there, what are the circumstances, what is the weather condition, or which type of food is there, and what is the weather there, and how the surroundings are there. So all those factors are outward to us, and we should understand the inward, that is our body, our health condition. So we should concentrate on ourselves as well as the food. Food is external to us. The moment it goes in, then it is a part of your system. So we should turn inward and outward very carefully and mindfully. That is, it should be like a front and rear cameras of a mobile phone, which with a single click we are flipping front and rear cameras. So we should also have that control over our mind, our consciousness, our mindfulness, to concentrate on to turn inward as well as outward whenever we wish to. We should concentrate on the eating process. It is a combination of external and internal. So we should concentrate on both the processes. What is eating process? How you are sitting, the sitting posture, how you are eating, the how with the hand you are eating, touch, all the five organs, sensory organs, should be used much effectively in mindful eating process. The role of sensory organs, suppose touch of the food will have some sensation in your body. It will go to your mind and it will start salivating in the mouth. So saliva has an important role of in digestion. In the digestion process, saliva and the mixture of food with saliva is an important aspect in digestion. Half of the digestion is done in the mouth if you are properly chewing it and mixing it with the saliva. So that is an important aspect, and we should use all the sensory organs to feel the touch, because more salivation will come because of all these sensory organs. So uh, that is mindful eating actually. So we should understand the digestion process, how it is functioning, and we should not overload the digestive system. Okay, so it should not be like garbage in, garbage out, right? So in between, the process of digestion system is getting overloaded. That also we should be very consciously monitoring, and we should be mindful about that. So we should feel the responsibility of ourselves, of our mindful eating and our health. We are responsible for what we eat. We are responsible for what we reap afterwards. What we sow is what we reap. So whatever you are taking, that responsibility also you should take. And after that, the consequence, the health, the effect of that food on the health, that also you have to bear with that. So we should feel the responsibility of eating good food for good health. Then once you feel responsible for that, you will automatically fulfill that responsibility of mindful eating. Let us be the catalyst for change. So we should start uh, practicing mindful eating technique, and we should bring the change in others also. First of all, we should change. We should be the change what we want to see in the world. It is told by Mahatma Gandhi. So we should follow that. We should be the catalyst for change. First of all, we should change ourselves, and we should be the motivators for other people to change our eating habits, and we should turn towards mindful eating. So we should eat mindfully, thinking about our health, our holistic health, and how the food, whatever item you eat, how it is affecting your health, and the overall picture, if it is clear, that is mindfulness. And we should observe very carefully how it is being processed, and you enjoy the entire process of eating good. So finally, we should understand what is mindful eating, what is mindfulness, what is eating, what is the effect of this eating and food habits and the diet on the health. So on physical and the psychological health or mental health. So that is holistic health, right? So what is the effect of food intake on that? That we should understand, and we should carefully focus on the eating process, that is mindful eating. So we should understand the entire process first, then feel it, then observe the process step by step, change the process. Suppose if you want to change the intake, or if you want to sensitize more, get sensitized uh, more, then also you should change your viewpoint towards that. So that is through mindful eating. And consistency. So one day you have tried to practice this, and then you have left it. It should not be like that. A habit formation will be there once you continue it for 21 days or 21 times at least. So that type of consistency, if you are trying to maintain, you can change your habits as you wish to, especially in the case of eating, that is through mindful eating. We should embrace the entire process. We should enjoy, we should explore this process to the fullest possible extent, and we should enjoy each and every sub process of this mindful eating. Thank you so much.